COVID is real, and again, we find ourselves continuing to deal with this virus. For today, for example, we are reporting 175 new cases today, and 6 people who have died as a result of COVID-19. But I will say, you know, the Hispanic community, Latinx community has been hit disproportionately hard. I think this is one of the first days in a long time when in that 6 number, there is not one Hispanic in that 6. I think this is the first time. And so hopefully the messaging is getting out and people are putting on their masks, and we're bringing down these numbers. But still, the virus is still very much present. The COVID-19 pandemic has affected every aspect of our lives, and many people are facing new stressors as they move through their new normal. And quite frankly, that's all of us. Every single one of us, including your mayor. You deal with these things every single day, day in and day in and day in and day out, and all of us need a little help along the way. Community coalitions, public health departments, and mental health organizations play an important role in ensuring that the public's physical and mental health and safety is maintained. And that is why today, the City of Houston and the Houston Health Department are launching the Let's Beat COVID-19 Health Education and Support Services Initiative. The program, supported by $340,000 plus of CARES Act funding, and let me stop there because the CARES Act funding comes from the federal government, and so I want to thank Congresswoman Sheila Jackson-Lee for actively participating to make that happen.
Thank you for using it. Thank you.
And in the absence of this funding, we would not be able to put forth this initiative. Includes a mental health helpline and other resources to help people adjust mentally and emotionally to the stressors associated with COVID-19. And the program will also make mental health services available to the City of Houston's frontline employees, as well as parents, guardians, teachers, and students. As city officials, we have a responsibility for being responsive to the mental health needs of our communities. And look, and there is absolutely nothing wrong with seeking mental health. If you break a leg, you seek help. If you break an arm, you seek help. If you need something with your heart, you go and get the help. There's nothing wrong with seeking additional support and services for your mental stability as well. And people have lost family members to the virus and have lost jobs as a result of the pandemic, not to mention the challenges of schooling children at home and social distancing. All of this can lead to a great deal of isolation. Lastly, I am hopeful that through this program, Houstonians will realize that they are not alone, and help is just a phone call away. Whether it's 12 o'clock noontime or 12 o'clock at midnight, help is available to you. And together, we can empower people to gain the knowledge they need to not only survive, but also thrive in this new reality of a global pandemic. And I'll be so glad when this COVID-19 is gone. Yeah. And I mean gone. Yeah. Because I know I tell you to put on the mask, and I'm glad you are. But I tell you, when I get home, before I take off the suit, this got to go. Where I feel like I can breathe again. And not just on the outside, but on the inside. But in the meantime, until COVID is gone, whatever help you need, is nothing wrong with just getting the help you need to get past this day, one day at a time. And then, as my mom would say, tomorrow will be better than the day. But in the meantime, if you need help, whatever that help may be, emotional, mental, spiritual, whatever, The good news is that there are people like Dr. Bill and her helpers that are available to do it. So let me just say, don't hold it and operate in isolation. Seek the help you need. Get what you need until such time we can come back together in a real way without the mask, shake hands, embrace one another, have people around at our homes, all of those things, because you are not alone.
Not alone.
You are not alone. So do take advantage of the number. Thank you, Congresswoman, again. Appreciate the financial support. Director Williams, on behalf of the Health Department, St. Joseph, and all of our healthcare institutions, and Dr. Bill, and all of your helpers, thank you for what you're doing on behalf of all of the Houstonians in our city. Thank you, Councilwoman.
Thank you so very much. Thank you, Mayor, very much.
Good afternoon, and thank you, Congresswoman. I really appreciate your ongoing support in our battle against this COVID-19 pandemic. You're right, Mayor, she has been an advocate related to testing and everything else related to COVID. But I really want to give a really special thank you to my boss, the Mayor, Sylvester Turner, because he's really been a great leader in setting an example of how a city of this size should be responding to COVID. One of the things he did not tell you, oftentimes, yes, he's going into that house, pulling that mask off, but he's also picking up that phone, calling folks, because this is a person that really cares. Stephen, why aren't we able to get more people into testing? Can't we set up more testing sites? Can we respond to this? You know, you don't mind working for a person who has a passion and who really cares for people. And I can say that my boss, Mayor Sylvester Turner, has a passion, he cares for people, but he also pushes his directors too. You know, the stress of COVID-19, as everyone said, has really put stress on everyone. I'm a personal witness to the fact that parents, guardians, childcare workers, students, frontline responders, and others need that support. And so when the opportunity presented itself for us to really provide a level of support that I thought that was really culturally specific, it was easy for us to say, yes, this is something that we know needs to happen. On October the 1st, we're going to launch this. The hours actually are from 1 p.m. to 11 p.m. And that number, as the Congresswoman said, is 713-999-9442. But the thing that is really important is that they're going to start off with this hotline, but then there are going to be virtual support groups, there are going to be toolkits, training, and other resources there to support people's mental and emotional needs. But the thing that's most important and most relevant about COVID is that we knew that when we brought this resource on, we wanted it to actually focus on what we call high priority zip codes.
Yes.
And so therefore, we're going to certainly do more extensive outreach in those high priority zip codes to ensure that folks know that they have access to this. A thing that I actually discovered doing a roundtable with my staff is the level of stress that they were experiencing, especially as it relates to this virtual learning and other stressors. And so one of the things that I turned to my assistant director, Deborah Moore, who is with me, and said, okay, if we're going to do this for the general community, it has to be available for my staff too. And so this is another population, not just my staff, but the city staff. This will be available to them. What I realized is that there was a certain level of expertise and professionalism and cultural appropriateness that this group brought to the table. And so therefore I wanted to take advantage of it. And so I want to thank the Congresswoman for her support. Thank you, Mayor, for your support. I really appreciate your passion for people. I know that you care, regardless of how hard you push your directors sometimes.
Thank you very much.